I'm Tony Star with bnetTV. We are here at the mHealth Summit in Washington, D.C. for 2012, and I'm speaking with Miss Diane Kaye from Ashthmapolis. How are you today, love?
Good morning. I'm doing great this morning.
Good morning to you as well, and thank you so much for coming on the show.
Thank you for having us.
It's
We'd
our
love to be
pleasure.
here.
And great convention. It's grown in size over the last year tremendously.
Yes.
This market space is heating up tremendously.
Yes.
And for all of the people out there in bnetTV land, why don't you give us a brief overview of Ashthmapolis and what you're all about?
Sure. Well, we're a company and we're focused on chronic disease management, focused specifically on asthma. We also focus on COPD, so anybody with respiratory illnesses. What we do is we have a sensor right here, very cool looking, right? It sits on top of inhaled medication. So for someone with asthma, that would be a rescue medication if they're experiencing symptoms, or for people that also are prescribed a controller medication that they use daily to help manage their asthma. This sensor, which we manufacture, sits on top of the medication, and anytime someone uses the medication, we'll press it out there, and the sensor picks up the time, the date, and the number of times they press. Not the medication dosage, but the number of times they press. Leveraging a smartphone, an Android, or an iPhone, we can also work with a Qualcomm 2net hub. We pass the data from the sensor to our servers, and when we're leveraging a smartphone, we pick up location information from the GPS within the smartphone. What that does is gives us a lot of information and insight about what's happening to the patient, why they're using but that they use their rescue medication, where they are, whether they're in sort of certain things happening in certain locations at a work location, or for a child as well.
You're grabbing metadata and defining some metrics behind it, and it excites me so much to speak with companies that are innovative in using smartphone technologies and health devices, and it's exactly what this summit is all about.
Exactly. And then we take that data, leverage it, do a series of analytics, leverage national guidelines, and then turn insight and information back to the patient via our mobile app that they download from the App Store, via our website. We can also set up for text messaging, etc. So our real goal is to enable patients to do a better job managing their own asthma. We also make that data available to their clinicians, caregivers, care managers, or for a child with asthma, their parents, so they can understand how well their child is doing, whether they're using rescue medications while they're on the basketball court, they had an incident and they weren't there, etc.
What do some of the numbers look like? What do some of the analytics look like for how many inhalers are in the market space today, and what type of adoption rates that you're inevitably looking for?
Right now, we have about between 600 and 700 actual users of our services. We were, I should mention, FDA cleared in July of 2012. This past July, our apps and our sensor, and that gives us the opportunity, obviously, to sell commercially. So we have a number of large programs that started as clinical studies prior to our FDA clearance, and now we're selling commercially in the market.
How many inhalers are in the market space?
Inhalers, well, we know there are 25 million people in the country with asthma.
Okay.
Again, not even looking at the folks with COPD, which I haven't really mentioned.
Okay.
And that we know about upwards of 60% of those with asthma actually have what we define as uncontrolled asthma, meaning they don't have their asthma within control. And that's the population we're really targeting, those that could be experiencing better quality of life, that could have lesser symptoms and improved health, and thereby reductions in emergency room visits, hospitalizations, etc. So that's really the ROI we produce for people, is improved quality with less utilization of costly healthcare services.
We've spoken to a number of companies throughout the event so far, and one of the trends that I'm seeing from companies is giving analytics and data back to the user and empowering them.
That's
and
exactly
by
right.
empowering them, they have the choice whether to change or make some changes within their lifestyle to better or not better.
Right. That's really the key, right? Collecting data is terrific, but the data are only as good as you can use it to create behavior change. And what we really believe, our services are patient-centric. Everybody is different. Some people want a text message to remind them to take their controller medications. Other people want to look at a website. There are the patients who will still want a phone call that we can enable as well. So the goal is to understand patients specifically. We know they'll utilize the system and engage with it differently, but that's really the end target, changing behavior, not just collecting data and doing analytics for data and analytics.
But at the same same time, if you're collecting data and finding that maybe there is an environmental control that is an issue in a particular area, and that may fuel action on another party.
That's very true. I mean, a good example of that are environmental hazards. So we do have a large study going on with the city of Louisville, and that's where it's really looking at public health concerns around environmental hazards in the city of Louisville and how that exacerbates people's asthma within that city. And that's a collaboration with the city of Louisville, healthcare system, employers are engaged as well. So that study is ongoing right now.
It would also sound like the platform that you built has some scalability in the sensor range in other devices. So you're not, and I'm just guessing here.
Right, right. Well, right now we are focused on inhaled medications, and we are focused on respiratory disease. Most people that use a rescue inhaler will use, this is a metered dose inhaler.
Okay.
Not 100%, but many do. And for controller medications, there are some different form factors. So we are looking at sensors that will look different and that are available to different form factors of drugs that are used for asthma and COPD.
The next logical question is, where do I get it? How much does it cost?
Sure. Well, while we're experimenting with direct-to-consumer sales, for example, moms with children with asthma are a great target market for us. Right now, our primary focus is really selling through payers, as well as health systems. So we're looking at people who both have the economic incentive and the clinical interest to improve asthma and also to help better manage patients with COPD. The sensor, we charge a one-time startup fee per patient, which includes any number of sensors that a patient may need. It includes the onboarding of that patient, enrollment of that patient, so that we know who they are, we know who's using the sensor, what medication it's attached to, etc. And then we charge a monthly fee for users, given it's not just a device we're selling, but an ongoing service and platform that we support.
Diane, what a fantastic company. You are well positioned within this
thank
marketplace.
you for that. We're very excited.
It's really great, again, to see technology meet health, and the mobile health ecosystem is going to change life the way that we know it, and clearly
we hope it will.
You're in that game.
We hope it will.
Congratulations.
Thank you so much.
Thanks very much
for speaking with us.
I've been speaking with Diane Kaye of Ashthmapolis here at the mHealth Summit in Washington, D.C. for 2012. I'm Tony Sklar with bnetTV.